session by Vision HVAC, and I would like to welcome our speaker for the session, Mr. Vijay Panchal, the Director of Vision HVAC Private Limited, to please join us on the stage.
Good evening, everyone. Myself, Vijay Panchal. I am Director of Vision HVAC Private Limited, and we are mainly into HVAC solutions, also into indoor air quality, which is taken care by Vision Tech vertical. I am not going to talk more about my company today. We are three pioneers, myself, Darshan, and Nilesh Shah. As we all know, HVAC is very important and crucial. HVAC stands to heating, ventilation, and air conditioning. Generally, heating is not very much required in Gujarat and Ahmedabad. AC is always there, but V is generally little bit ignored. But HVAC is very crucial in hospital, and normally in medical terminology, as we all know, there are different category of doctors like orthopedic, like gynec, and many more. In HVAC also, there are specialists. So Vision HVAC is specialist for all the healthcare solutions. We are into many diversified project institutions. I am not going to talk other projects, but we have done more than 100 projects of clean rooms for healthcare and pharma. This is the interesting case study. This is basically a Siddhivinayak hospital. Post-COVID, I received a call from Dr. Abhay Khandekar, and he asked me to study this site and give the solution about ICU requirement for their hospital. I have studied and I found many challenges over there. Some of the challenges like height is the constant, because in existing building, it is difficult to execute HVAC considering the height. Space of AHU is also a big constant. Similarly, in ICU, as we all know, there is big issue of fouling smell due to medicine, because patients are passing stool and urine in the ICU. So generally we are accepting that particular thing that in ICU it is going to happen. But we have a solutions. It is not like that. We can control fouling smell as well in terms of TVOC. COD is again important factor. Generally, if COD is not okay, as it is airtight room, we are generally trying to reduce the temperature of AC to make the patient comfortable. But that is not the right practice. We need to control CO2 as well, because if CO2 and environment is in good condition, we may have create good condition even if at 26-degree temperature. So that also we are controlling. We have given a solution to that particular project, that is IQR system based at Switzerland. We are also monitoring the air quality in that particular project, and you can see at our business launch, we have shown the live presentation of that particular thing. Real-time data is already there. There are some of the silent key features of that particular system. It is going to save your space, because footprint area is very much expensive nowadays, and AHU placement and other things is going to consume more footprint area. It is going to be almost nil maintenance. That system doesn't require any maintenance. It is consuming very less power, because in India, the motors which we are using, it is maximum rating is EER 3. But in this particular machine, we are using energy efficiency rating 6 motor, that is EC motor, which is consuming ultra low power. Similarly, this system has hyper HEPA filter and multiple carbon filter, which is going to take care of odor. This is some of the screenshot to just show you that it is a report up to PM 2.5, and this report is going to, I think you can see, of entire year, more than a year, it is 13 months. The graph of PM 2.5 is almost in the range, and PM 2.5 level is around 6 micron of 1 cubic meter, which is ultimate result we are achieving. It is almost near to class 1 lakh, that is class 8, ISO 8. PM10 also you can see. CO2 level. As I said, CO2 is very important criteria in ICU as well as in other room. So, doctor can save energy in terms of less usage of AC. Normally, what happens, ज़्यादा temperature करके हम लोग कंबल दे देते हैं patient को. That is not the good thing. If we are going to maintain CO2, we can make patient comfortable by giving good these things. And especially for respiratory patient, it is going to help us. TVOC. As I said, TVOC in ICU is going to really a big challenge because normally patient doesn't want to live in that particular room more than a couple of days because they are going to be really in a trouble due to TVOC. So TVOC you can see for entire year it is green. So TVOC is 7 ppb, which is ultimate result in ICU because ICU is the most contaminated area even than OT. So this is the remarkable results we have achieved, and the live real-time monitor, as I said, it is there in our business launch. This is another example. Yesterday only I came to know when I met Mr. Neeraj Lal, CEO of Apollo Hospital. He just told me that his bone marrow transplant unit is doing 6 bone marrow transplant, which is the highest number in Gujarat, and that was the first BMT of Gujarat. That was fortunately done by us before 10 years. And it is successfully working. And this is another case study I am going to tell about. As in BMT, there are many challenges in terms of cross-contamination, comfort condition of 24/7 and 365 days. Irrespective of ambient temperature, is 5 degree or 45 degree. We have to maintain certain temperature inside the room and inside the attendant room as well. It should be, system should be high, having high redundancy, should not have any maintenance, positive and negative pressurization. There are specific requirements from Apollo, and Apollo Hospital called me at Chennai, and I met Dr. Pritha Reddy and discussed about the requirements. So she told that it should meet all international HVAC standards before 10 years. So we have executed their system according to the standards. It is ISO 8 at 100% one-through system. That is the biggest achievement we did. System is very reliable. As in front of you, it is working from last 10 years. This system has highest filtration level. There are many pre-filters and intermediate filters are designed in such a way that HEPA filter installed in the terminal is going to have more life. Otherwise, in one-through system, it is going to be a big challenge that we have to replace the HEPA filter frequently. And system has advanced heating and cooling system, control system, which is synchronized in such a manner that irrespective of any outdoor condition, it is going to maintain good comfort condition inside the area. Terminal HEPA filter we have installed in attendant room as well as patient room. So whatever air we are delivering into the area, which is through the terminal HEPA filter. Patient room and attendant room, we have to maintain the pressure according to the requirement and as per the guideline. So we have installed pressure magnetic gauge inside the patient room and attendant room, and we can monitor and check all the parameters 24/7, and we can maintain it. Now I am going to handing over to Mr. Darshan Dave, who is going to tell a little bit about our company. Darshan, all yours.
Thank you, Vijay. You can change the slide for me. So this is what Vision HVAC Private Limited is all about. Company engaged into HVAC solutions and indoor air quality solutions under the brand name Vision Tech. We have completed in the terms of capacities, we have completed 500 plus projects, 14,000 plus tons of air conditioning installed, and 1.3 plus million square feet of area covered. Next, please. And in terms of segment, we have covered 125 plus pharma as well as healthcare projects, 100 plus corporate projects, 10 plus mega industrial projects, and a few international, that is global projects. couple of them in Russia, one in Thailand, one in Croatia, and the last one in Japan. That is what Vision HVAC is. Your asset, our commitment. Think HVAC, think Vision. Thank you.
May I request you to be present over here, and I invite Ekta Modi to please join us and present a token of gratitude.